होगा. Radiological picture will all be similar to what it was before, okay, except that there will be no symptoms. The mucosa over the apex may or may not be tender as well. वहाँ पे the mucosa was always tender. In this particular case, the mucosa is not tender and it will not be responsive to pulp testing. Understood? Because the pulp is already necrosed, so there will be no response when we do any kind of pulp test. So when we see a histological examination, there will be granulation tissue. Now acute abscess or acute symptomatic apical periodontitis, did not have any kind of granulation tissue there. Now since this is a chronic condition, there will be some kind of granulation tissue which will be formed. Okay, there may be some kind of fibrous capsule and fibroblast may be present. So why do we see this kind of histological picture? Because my infection was low grade, my body has been trying to protect itself from the infection. So when my body tries to protect itself from the infection, there will be lot of fibrosis which will be present there. There will be lot of granulation tissue. So it's like a body which is just trying to close. Suppose this door, there are a lot of people coming inside. We don't want you all are more inside. The bacteria is less outside. They are trying to push. You all are trying to close the door. Okay, so similar kind of thing is happening in the body also when we have your chronic infections. There is infection coming. There are some 2-3 people always trickling inside. But the body as such, suppose you all are the body's defense mechanism. You are able to protect and not allow the outsiders to come in. Okay, so that is a histological picture here. Treatment would be root canal therapy has to be initiated. Understood? So you saw the difference between your symptomatic apical periodontitis and asymptomatic apical periodontitis. Okay? Next is chronic alveolar abscess. We will finish with this. Okay, so chronic alveolar abscess kya hai? Again it will be a long standing low grade infection. Okay, so long standing low grade infection of the periradicular alveolar area where it is symptomless for the patient, and it can mostly be characterized as having a sinus formation. So now what is a sinus formation? You all would have studied in your general surgery. What is it? The infection, if there is some kind of pus formation, the infection, the body, it will always follow the path of least resistance. So the path of least resistance, suppose the pus is not able to drain through your apical area. What will happen? It will try and go it from your mucosa. Okay. So for your maxillary teeth, it will always be from the buccal side. If it's a maxillary lateral incisor, it will be from the palatal side. Because the inclination of the root of your maxilla, lateral incisor, is that it is closer to the palatal bone. So it is inclined palatally, it's closer to the palatal bone, it will drain through there. Okay, so that is, so when it is a opening, single-ended opening is present, it is called as sinus. Fistula is when there are two openings. Okay, so there will be a sinus which will be present there. So since there is a sinus, there is always continuous discharge of the pus that is happening. The patient is not experiencing any pain because at no point of time there is a pressure build-up that is happening there. Understood? So chronic alveolar abscess, it is a low-grade, long-standing low-grade infection of the periradicular alveolar area where the patient is symptomless and it may be characterized by presence of abscess with a sinus tract. Okay, it can also be called as the other names of it are chronic apical abscess, chronic alveolar abscess or chronic suppurative alveolar apical periodontitis. You need to know these other synonyms also for these diseases. ठीक है? Causes क्या है? Necrosed pulp with infection which is extending periapically, pre-existing acute alveolar abscess which has now changed into a chronic condition. Fine. Symptoms will be asymptomatic or the patient would say कभी-कभी दर्द होता है. So now why will the patient say that? When there is pus accumulation happening, the patient will have pain. Then there will be some kind of pus discharge from the sinus. The pressure will get relieved and the patient will say अब pain नहीं है. So the normally word how do the patients tell us this is दांत में सूजन आता है, फिर एक फुंसी बनता है और फुंसी से पस बाहर आके चले जाता है. ठीक है? So this is the condition, the symptoms, yes, things that the patient will tell you. ठीक है? That is why you need to take a proper history from the patient. You need to ask questions from the patient. Okay? And if it is a anterior tooth or non-vital tooth, it can be discolored as well. Okay? Diagnosis will be with the help of radiograph, because we will see your apically, we will see radiolucency present. If there is a sinus tract, okay, we need to trace the sinus. How do we trace the sinus? You need to place a gutta percha. So now suppose this is the particular tooth. In this you are not able to see, there is swelling which is present here. This is an intraoral sinus. Sometimes the patients can also have an extraoral sinus. That means infection हुआ अंदर से, it has been such a long standing infection that pus starts to drain from here also. Normally seen with your anterior teeth. Okay? Or so in this particular condition, when we say we need to trace the sinuses, we need to place a 25 number GP point and into the opening which is present there. So once you place it, it will follow the path जो आपका pus लेता है. Okay, so when it is following that path, when you take a radiograph, you are able to identify the tooth which is causing the problem. So this condition, this is helpful when you have two adjacent teeth which you feel that both of them have infection, but you are not able to isolate which one is the one which is causing the problem right now. So when you trace the sinus and you take a radiograph, since your GP is radio opaque, it will trace to the area which is giving you trouble. Okay, so this is how you trace your sinus. Okay, so this is a diagnostic method. Histologically you will see similar picture. Fine, there will be lymphocytes, plasma cells which will be present, fibroblasts may be present, and sometimes PMNs may be present in the center. Basically the treatment is to eliminate the infection, that is through your root canal therapy. Okay, understood? So you understood your asymptomatic apical periodontitis, you understood your chronic apical or chronic alveolar abscess. Okay, should we continue? No. So now next